Hi, everyone. Welcome to the show. I'm Dr. Nicole, and on today's episode, we're talking about supporting children with behavioral challenges using love and connection. The whole premise of this show is that we need to understand the root issues going on with kids so that we can support them in ways that help them grow and develop to their fullest potential. It's not about punishing kids or just getting rid of surface level behaviors. We all know that doesn't work. So my guest today is Bryan Post, and he's been doing great work in this area of compassionate support for children with challenges for years now, particularly with children who come from backgrounds involving trauma. This is going to be a really eye-opening conversation. I've been looking forward to it for weeks now since we scheduled it, and I really think it's going to help you come to see and approach behavior issues with your children quite differently. Let me tell you about Bryan. Bryan Post, an adopted and former foster child, is one of America's foremost child behavior and adoption experts and founder of the Post Institute. A renowned clinician, lecturer, and best-selling author of From Fear to Love, The Great Behavior Breakdown, and 10 other books, and more than 100 video and audio programs. Bryan has traveled throughout the world providing expert treatment and consultation to a variety of groups. An internationally recognized specialist in the treatment of emotional and behavioral disturbance, Bryan specializes in love-based treatment approaches that focus on developing a deeper understanding of trauma, stress, and fear and how they rule our lives. He counters this by offering an enlightening perspective on the all-encompassing power of love to bring us peace and healing. Bryan, so wonderful to have you here today.
Thank you so much, Dr. Nicole. It's my pleasure.
And I know you're on the road, and so especially appreciate you making time for us while you're traveling and teaching and doing all the amazing things that you're doing.
Yes,
I would love to start out by having you just share a bit about your story. How did you come to be doing the really important work that you're doing with kids and families today?
Well, I think it's all fundamentally rooted in my own origin story, being adopted, being in foster care, and growing up in a home with two loving parents, a mom and a dad, to my sister and I, who was also adopted. We're not biological siblings, but who really struggled with us because they parented us in a very traditional way, and it was completely contrary to what we ultimately needed. So it created a great deal of conflict. I was the more socially and emotionally advanced child. So my behaviors, which I think I really do feel like I had worse behaviors than my sister. I just got away with them better. However, she was, because of her early origins, she was emotionally immature, and that clashed perfectly with both my parents, who were parentified and both who were adult children of alcoholics. And my dad was a Vietnam veteran. And so that combination just created World War III in my home, really from the very beginning. And my mom said, when we first got you, and we were both adopted as infants, when we first got you, you were smiling, and when we got your sister, she was crying. And I do believe that formed the early relationship blueprints for our relationship. And so it was in that dynamic and experience throughout growing up that I really do feel like formed the roots and shaped my passion for challenging children and for stressed out parents. And that was really a process too, because for a long time, I looked at it as a failure of the parents to understand the child, and went through even just as a therapist, went through a real process of where I was focusing a lot on just the child and feeling pretty frustrated by the parents, until I finally came to the realization and understanding that parents have their own origin story too. And it is the entire family that is afflicted by stress and fear and trauma. And so the way we approach children, my love-based approach, is the same way I had to learn to approach parents. And that's kind of how it evolved over time.
So powerful how your personal story of growing up has led you to be doing this work. And I think that's true for many people in the field, and is so helpful for you to be able to look at what worked or didn't work for you as a
Yeah.
child and be able to say, how can we take that and use that to inform what we're doing with families? And I couldn't agree more about the parent dynamics piece of it. You know, so often parents will bring their kids into, you know, our clinic, and it's like, do something about my child.
Yeah,
It's
sure.
like, okay, I get that. And we need to take a step back and look at, as you said, the entire family system and the dynamics here, because
Yeah.
boy, there is nothing like challenges behaviorally in a child to trigger our own stuff as adults, right?
Oh,
Yeah.
it's so much so now that I spend probably 90% of my time with the parents
Yeah.
and only 10% of my time with the child. And even then, I always work with the parent and the child together. I don't work with children by themselves. And so it's just fascinating the way it works.
Yeah. Well, and that's interesting, because we're very much the same way at our clinic. You know, the majority of the time is spent either with parents or with families together, especially when children are younger. When kids get to be, you know, young adults, a little different. But oftentimes parents will say, well, that you're blaming me, you know, the fact that you're saying you need to work for me with me more than my child, you're saying this is my fault, which is really, you know, not the case. But I'm curious, do you hear that quite a bit too?
You know what? I used to experience that a lot. And that over time has kind of dissipated. I don't hear that as much anymore. And I think it's just because, you know, fundamentally I may go in and so I always start just like yesterday. I'm on the road. I've got families all up and down Northern California that I support, but I, you know, go into a home for the first time with a mom, and it's just she and I. The child's at school, and I usually always start that way. I believe where you start is how you finish. So if I start with mom and I'm understanding everything she's got to say about her children and going through their processes and their histories, and then she keeps saying certain things that just jump up about the importance of education, and then in her life growing up and to her, and then how she started caretaking these family members. And then I said, okay, tell me about your story, because I want to understand what's going on with you. And she was like, oh, okay. And so she starts telling me about her story, because I'm listening. I'm trying to put together these puzzle pieces. And then I asked her, I said, has there ever been any physical or sexual abuse in your experience? And she froze for a moment, and she said, yes. And I said, okay, that's really good to know. And I said, what I'm hearing is some dynamics with your children that are actually triggering some trauma for you. And she said, I've only told one other person that in my entire life, and that's my therapist. And so it's like, I think it's just a process. If we, as we take the process, the parents feel less defensive, because it's no one's fault.
Right.
It's no one's fault. It's ultimately all of our responsibilities. But when it comes to children, adults have to be willing to take responsibility first, or you can't teach your child how to take responsibility. And when I talk to parents about healing trauma, it's you have to heal your trauma first before you can help your child heal their trauma. It's not fair. And I used to, you know, tell therapists that, you know, your parents bring kids into the home and into the therapist's office, and they're like, here's my kid, and they want to run off. And I'm like, wait. We got to change that. And that's not the fault of the parents. That's the fault of the mental health professionals, of the psychology field that's created that framework of understanding. And it goes all the way back to diagnosis, and it goes to the medication. Everyone's pointing the fingers at the child. And so you have people who are behavioralists, and all they focus on is behavior, and it's just ass backwards. And it's such a sad thing. So I feel like professionally I've been able to get to a place to where I can navigate those waters a little more effectively.
Yeah, you're singing my song. I love it. I want to dive into talking about stress, because this is really a cornerstone of your model and what you teach families in terms of understanding the role of stress when it comes to behaviors, when it comes to, our own experience as parents. So let's dive into that. How important is understanding stress when it comes to understanding and supporting children with behavior issues?
In my professional opinion and personal opinion, based over 20 years of working with the most difficult children and families around the world, it is the single most important thing. It is the foundation. 20 years ago, I came up with a theoretical model called the stress model. And the stress model says all behavior arises from a state of stress. All behavior, good and bad, arises from this physiological, cellular experience, neurobiological experience of stress. And it is so all behavior arises from a state of stress, and in between the behavior and the stress is the presence of a primary emotion. There are only two primary emotions, love and fear. Everything else manifests from those two states. So I tell parents that emotion is energy in motion. So emotion is really just energy, and our body only knows surviving or thriving. When we become stressed, we constrict into survival. And that survival state is what leads to the pathway of fear. So it's not always fear like, oh, I'm afraid of someone. It's just fear. I smell something and it stresses my body, and that drives behavior. And so that becomes a dynamic model, because with children and that the more intense and severe the behavior, the easier it was to reduce it. Because the more intense the behavior, the more intense the stress. All I've got to do is give the parents a couple of techniques, a couple of ideas, an understanding to help them reduce the stress. And all of a sudden, these behaviors they've been dealing with for years reduce. Sometimes just immediately, just like go away. And so I started to get really excited, because parents would come with these severe behaviors, and I'd be like, oh yeah, this is good. And it's helping parents understand that if your child is acting out, it's because they're stressed out. And if they're stressed out, it's because now they're regressed. So you're no longer dealing with a chronological age, you're dealing with an emotional age. The emotional brain dictates everything. You know this. However, when your child is acting out, you as the parent see the behavior, and your brain interprets it as a threat. Therefore, you become stressed out. Therefore, you move into survival. Your fear escalates, and it drives your behavior. Now you've got two stressed out individuals. And when you have two stressed out individuals trying to figure something out, you're just going to get more craziness. And so helping parents understand the critical importance of calming their own stress first before trying to correct their children just formed the linchpin for everything that I do. And so that core kind of stress experience sits right on top of the brainstem, which is where we store all our trauma memories. And so when we get stressed, our trauma is likely to get triggered. And that's when we get into helping parents work through their trauma so they're not so reactive.
Mm-hmm. Well, and I think that role of trauma in behavior is something that has been so ignored.
Yes.
Lately, we're starting to hear, more about that, a broader recognition of, things like adverse child experiences, these kinds of things. It's starting to be more widely recognized, but still by and large, many professionals even are unaware of the role that trauma plays, particularly, when we're talking about kids with even neurodevelopmental issues, kids who've been diagnosed with ADHD, with, bipolar disorder, all these kinds of things. The role of early trauma in particular has been neglected. So I'd like you to speak to that, because you've got particular, experience and expertise with that. And let's even start with, like, when we say trauma, what are we really talking about there? What do parents need to be aware of about what trauma can be and can look like and how that impacts behavior?
Absolutely. Trauma is any stressful event which is prolonged, overwhelming, and unpredictable. Any stressful event. I had a dad doing some work once, and he's like, "Oh, I didn't really have any trauma or nothing." And then as we talked about 5 minutes into his story, he starts talking about his little brother, who when he was his little brother, his older little brother, I can't remember, it was his best friend. His brother was his best friend. But at about 10 or 11 years old, his little brother says that he thinks he's gay. And then the dad was devastated, the sibling was devastated, but the father completely alienated and isolated his brother. And he said it was horrible. And I said, that's a traumatic experience. We don't realize that trauma is any stressful event which is prolonged, overwhelming, or unpredictable. And when that event continues on unexpressed, unprocessed, and misunderstood, that's the difference between a short-term stressful experience versus a long-term, potentially life-altering traumatic event. I had a mom once in a lecture. She heard me give that definition, and at the lunchtime break, she was like, "Oh my gosh, I can't believe what I have just realized." She said, "My entire life," this is a 50-year-old woman, she said, "my entire life, I have been terrified by birds." She said, "The other day I was getting ready to go to work, and I got in my car, and a bird flew down on the hood of my car." And she said, "I froze." And she said, "I begged that bird, 'Bird, please get off of my car.'" She said, "I couldn't move. Finally, the bird flew away." She said, "I just realized that when I was 5 years old, my sister and I were playing in the backyard, and we had a chicken, and that chicken attacked us. And there were feathers everywhere, and I've been terrified by birds ever since." We forget these things as we get older because we become less emotional and more cognitive. But trauma is pervasive in our society. We live in, 20 years ago, I was talking about we live in a traumatized society. Now look how crazy society is. We're all lunatics. I mean, it's all stressful, so stressful. Then being out here in California where people can barely afford to live without working 2 jobs and working 16-hour days, man, it is just so intense. And the thing with the whole trauma-informed movement, it's fantastic. The problem is that once again, we are focusing too much on children. We're not focusing on ourselves as adults and parents first. We're missing that understanding. So I tell people, I'm really excited that we're talking about being trauma informed, but you have to move beyond being trauma informed and learn how to be trauma responsive. And I said, anytime you're taking a trauma informed course and the first thing they start talking about is the impact of trauma on children, your ship has already left the dock in degrees off. And that's we really have to look at that. And I just, it's unfortunate that we are so fearful of looking at ourselves, and that we want to push children into looking at themselves so fast, but we don't want to do our own work.
Well, I think that's so true. And I want to just for a moment focus in on trauma as it relates to adoption, because I don't know if you've seen this, but we do see a fair amount of children and families at our clinic where adoption is part of the story. Many of us actually as clinicians at the clinic have adopted children ourselves. And one of the things I find interesting when we start talking about trauma is, first of all, the lack of recognition for many of these parents that their journey to parenthood oftentimes has been trauma-filled for them. So that being, on their end of things, but oftentimes parents will say, "Oh, no, we got, our child very young, there wasn't any trauma," like sort of this assumption that trauma only amounts to like, oh, if you got a child through foster care, for example, who had been severely neglected or abused. Like, I think there's a recognition that constitutes trauma, but people really minimize other kinds of trauma that can happen even when children are, brought into families at really young ages, that there's trauma involved with that. And I think that's surprising for a lot of parents to hear or to consider.
I spend a great deal of my time focused on the in utero experience. Thomas Verney, author of The Secret Life of the Unborn Child, says that as early as the fourth week, as early as the second trimester, the fetus is capable of psychological processing. It was Mitch Gaynor, who specialized in sounds, who said as early as the fourth week after conception, the fetus can hear. So I have to help parents understand that it doesn't matter what age this child comes into your life. Adoptive parents, it doesn't matter what age this child comes into your life, their in utero experience has already significantly defined them and will oftentimes give root to the challenges that they've experienced. This is a classic situation just yesterday with an in utero trauma experience. And then helping parents, one of the things about parents not understanding their own trauma is our lack of recognition for emotional absence and parental depression. Yeah. How that is, I believe, the single most pervasive form of trauma in our society, and the least understood and the least researched because you can't see it. So scientists don't spend a lot of time on it. But Tiffany Fields has helped us to understand that the presence of emotional absence in parents, and if you think emotional absence, if you just think a parent who works all day and pays the bills and comes home and puts food on the table, there's emotional absence there, because emotional absence is stress. And stress communication gets communicated non-verbally. It's a mom I talked to yesterday. I said to her, how many times do you show affection to your children? And she had to think. I mean, she struggled to think, and she said, and at that point, I knew it was, 0 to 1.
Right.
So she said, probably once, in the morning before they go off to school. And then she said, oh, twice. Usually at night. I'll pat them. But the thing is I have to help her understand that those are her own blueprints because of her experience growing up. And then pushing her outside of her comfort, that comfort zone of being protective and what that's about. And so, yeah, I went off on a tangent. So.
No, it's great. It's why I've been looking forward to this conversation. As we think about the role of trauma, the role of stress for parents and for children being just really foundational to understand when it comes to trying to address behavior, let's talk about then how behavior is typically addressed and dealt with, right? Because the typical way when parents present with a child who's having behavioral challenges, whether that is violence and aggression, whether it's, just mood disturbance, temper tantrums, defiance, whatever it might be, there is a typical way that that's addressed, and it does not look at the role of things like stress and trauma and those kinds of things. The typical approach is, as a parent, you need to put consequences in place. You need to use behavior modification strategies. I'd like to have us talk about what you think about that. Are those kinds of tools effective at reducing these kinds of behaviors, at supporting kids with these needs?
Not only are they not effective, they are harmful to the healing process. They are hindering to the healing process. The reason children don't get better, the reason they grow older and don't get better, is directly connected to the way we approach the challenges that they have. We are oriented in our society, in our culture, in our families towards punishing behaviors. Punishing behaviors, however you frame it, whether you frame it as a consequence, whether you frame it as points of rewards, whether you frame it as spanking or yelling or isolation, whatever. Those approaches create more stress. And because behavior is rooted in stress, if you use an approach that creates more stress, you are hindering the healing process. And the way you know something doesn't work is if you have to keep doing it. If you have to keep doing it, or if you have to intensify it, and man, how I wish my parents had learned that early in life. If you hit a child once and that doesn't get it, and you got to hit them again and hit them again and consequence them again, and you got to take a toy away from them, and before you know it, everything in their room has been taken away from them, it's not freaking working.
Right.
Albert Einstein said the definition of insanity is to continue doing the same thing and expect a different outcome. Albert Einstein said that. But the thing we forget is that stress is at the root of insanity. And when we are stressed, our thinking becomes confused and distorted. So when we're stressed, we're not thinking clearly, and our short-term memory is suppressed. So we don't remember. That comes from Joseph Ledoux, author of The Emotional Brain. He's a New York University neuroscientist. We don't think clearly, and we can't remember in the midst of stress. So our children are having these behaviors because they're not thinking clearly. They don't remember how they were punished the last time. They're not thinking about the punishment from the last time. Their thinking's confused and distorted. Their short-term memory suppressed. And then we're punishing them because our thinking's confused and distorted. And we don't realize that the punishment didn't work the last time. And so we're doing it again because our short-term memory is suppressed. So it's a negative feedback loop.
It's like this, it's just this perpetual cycle that you can't get out of. And that's why so often parents will come into the clinic and go, okay, we've been doing all these things and nothing is substantially improving. Or the worst situation, we've been doing all of these things that we've been told to do, and we're actually having more problems now. Because, I think you probably see this too, but some of the most intractably anxious PTSD kinds of kids that we see, the real issue has been the treatment modalities that they and their parents have been put through to handle behavioral challenges and issues. And I'll tell you, one of the populations where we see that as a rampant problem is the population of kids diagnosed with autism spectrum disorders, where the very first line intervention often is go find somebody to do, applied behavior analysis, put your kid in a 40-hour-a-week intensive, very stress-based, behavioral kind of system. And we see parents and kids coming to us post those kinds of treatments, some of the most stressed out, PTSD kinds of situations. And, I think you probably see that as well.
Well, now insurance is paying for that.
That's right.
Yeah.
Yep.
So it's just going to become more pervasive. And at the root of that, what we fail to understand is that we are only focused on behavior. That cognitive behavioral therapy screwed us a long time ago. It's a top-down approach. We're only focused on behaviors. We're only focused on trying to change thinking. That's only working on the surface. We have to get into the emotions. We have to get into the stress. We have to get into the trauma. And we have to get into relationship. And when you're focused on behavior, you are actually working counterintuitive to developing stronger relationship. So those children get worse because the parents get more stressed out. The parents get more stressed out. They feel more helpless and they feel more overwhelmed. The therapists get stressed out because the kid's not getting better. So the therapist hunkers down even more on the parents being more firm, more strict, making that child toe the line even more. So it creates more stress. And eventually they get burnt out. And the therapist gives up on them or refers them to another therapist who then starts them through the same process. And after years, they finally make it to Dr. Nicole's office.
Yeah.
Usually years of therapy and medication.
That's right. Both.
Diagnosis.
That's right. That's exactly right. And now by this point, now we've got a bunch of additional diagnoses tacked on to the child, really because of side effects of inappropriate interventions. Yes. And, I say to parents when they come in with teenagers or young adults, I say, we can work at this. We can make improvements. And I think to myself, but man, would it have been easier if you first came in here when your kid was 4?
Yeah. Absolutely. 100%.
Yeah. So I think, we've done a good job of establishing now, the role of stress, that we need to be thinking about this stuff differently. And certainly, for parents who are listening, you know, um, there's nothing wrong with, like cognitive behavior therapy can be effective for certain things. There's roles for things, but when we're talking about children with pretty significant ongoing challenging behaviors and family dynamics that are not working and families that are stressed out, we got to look beyond that and look at these different types of things that we're talking about. So I'd love for you to share maybe a couple of things, how, if parents are saying, okay, wow, I get this now, like I see that this is an issue for me and my child for what's going on. What are a couple of things that you recommend to parents? Where can they start? Are there some simple shifts, some things that they can start even just on a basic level doing differently with their child, even right now today?
Yes, I'm going to give you the most simple things, but they're simple, but they're not easy.
That's right.
And here's where it has to start. The first thing a parent has to do, has to learn to do, has to condition themselves to do, is in the midst of their child's behavior, before they say anything to their child, before they do anything, the first thing they have to do is they have to stop, and they have to take 3 to 10 deep breaths. They have to breathe. They have to condition themselves to breathe in the midst of stress. The reason they have to breathe in the midst of stress is because breathing is the one proven way to interrupt our stress physiology. When a child is misbehaving, they are already stressed. If the parent does not stop and lower their own stress level through breathing, they don't have to do anything else, through breathing, lower their own stress level, then they dial down their cortisol level. When the parent can do that, they are able to then literally send a vibration, an oxytocin vibration, to the child, which will help lessen the child's cortisol. But if the parent cannot stop before they say or do anything, in the brain, the amygdala is telling the parent in the moment, red alert, it's a fire, someone's gonna die. So the parent wants to immediately engage. That's the first mistake. You have to stop, you have to slow down, and you have to breathe. You have to teach yourself how to breathe, because if you don't, that stress is going to pretty quickly escalate and drop you into your brainstem, which is where your painful memories are stored. Then that's going to skew everything. Then you're going to be in a negative dynamic with your child. You have to stop and breathe. And it's probably the one thing that if I could only teach parents one thing, it would be the power of teaching themselves how to breathe in the midst of stress, because it controls everything. If you cannot slow down and breathe, you cannot lower cortisol, which means you are going to have confused and distorted thinking.
Mm-hmm.
If you can't slow down and breathe, you can't turn on your oxytocin response, which is your brain's anti-stress hormone, which means your thinking is going to be, your memory is going to be suppressed. If you can't slow down and breathe, your amygdala is going to be sending off a vibration of fear and anxiety, and amygdalas communicate with one another. All of that before you ever say anything to your child, because your child is stressed. So that, number one, is the single biggest thing. And I really do believe, Dr. Nicole, that parents are wonderfully and beautifully gifted with the knowledge to meet their children's needs. Irregardless of trauma, regardless of the trauma, regardless of the history, parents are equipped. They have all the solutions within them. The first step is being able to keep your thinking online, being able to keep your short-term memory available. That's number one. Like I said, that's simple. It's just not easy. I spend days with parents working on the ability to override their stress reaction. And then number two, See, this becomes important because it will help the parents override that stress reaction. See your child's negative behavior not as anger, not as manipulation, not as defiance, not as being mean or being bad. See their behavior as coming from a place of stress. They are stressed out. They are stress sensitive, and that stress sensitivity drives their fear. They are scared. See a scared child. See a scared child. Breathe and see a scared child. When you breathe, you're doing all the mechanisms I just talked about, but when you see a scared child, you're overriding your amygdala who's looking for a threat. When you see a scared child instead of an angry child, you have a tendency to feel less threatened, which then helps you calm your physiology more and then changes internally how you respond to that child. The parent yesterday I was working with, 7-year-old daughter, who she said is mean. She said, my daughter just gets mean. She said she's a loving child, but then she just gets mean and nasty. And she said that meanness is what really stresses me out. And I helped the mom understand that not only is that meanness stressing her out, but it's dropping her into past memories. And we identified the past memories, and she's associating the vibration. It becomes really all about vibration. The meanness that's being demonstrated by the child is sending off a vibration, and that vibration is connecting with a vibration in the mom's brain, which is connected to an experience, which then causes her anxiety to escalate. And so when we are able to slow ourselves down, and then we can see that our child is not mean, our child is stressed out, our child is scared, it starts to change the dynamic. I mean, it really is pretty a remarkable process.
It's profound. I love that those are the two things that you shared, because I would totally agree that those two things can make such a profound difference in terms of how parents relate to their children, and ultimately in terms of how quickly we can diffuse the situation, prevent escalation, bring children back to a baseline where we can talk with them, work through what's really going on, as opposed to getting stuck in this, on this hamster wheel of two dysregulated people just running around and around and around and not getting anywhere.
Yes.
What do you say to, because some parents listen to things like this and they go, well, but at some point, the child has to be punished. We have to do something about this. We can't just let kids do whatever they want. We can't just love them like they're, and I think it's so important for parents to hear, taking this kind of supportive, love-based approach does not mean that we just allow kids to willy-nilly, do whatever they want in the world, and we don't have any expectations, right? I want to touch on that, because I think that's an argument that people use against thinking about things in this way.
And it is the root of why our society is the way it is, because we fail to realize the importance and the power of love. What you're doing when you're calming yourself down and you're lowering your stress and your fear is you're increasing your love vibration. And what looks to people like they're not doing anything or they're letting their child get away with something is not that at all. You're sowing seeds of love in the presence of your child's fear. You are literally, see, when a child is really stressed out, they're in their brainstem. Their brainstem has opened up. So when you're not reactive and you're being responsive and connected and attentive and attuned and you're present, you are harvesting and manifesting the power of love to put these little seeds inside the brainstem where previously all this fear has been. Bruce Perry says the brain always returns to the way the event was handled the last time. So you're sowing these seeds of love. And what that's doing over a period of time and repetition is it's developing internal regulation.
Mhm.
It's strengthening your child's internal regulatory system, which is how they handle stress, which is what they're going to take into the world and how they're going to deal with a stressed out world by having a regulatory system.
Mhm.
So it's not that you're letting them get away with anything. You're actually sowing these seeds of love. And then what you're also doing is in the midst of their stress and their overwhelm, when they're acting out and they're being crazy and they're doing crazy things, when you're not reacting, you're actually being the smartest person in the room.
Mhm.
You're realizing that you're dealing with someone who in that moment is insane.
Mhm.
You don't rationalize with an insane person because they're irrational. You don't use logic with an illogical person because they're illogical. So you wait and
Mhm.
you be present until you help them to calm down, until their thinking comes back online. So they are rational and they are logical. And then you communicate and you teach and you come to some understanding. And that just builds. It just builds over time. And before you know it, you can actually have a conversation with your child when they're stressed out.
That's right. Well, and the sowing of the seeds, as you said, what we're doing there is we are helping a child's brain develop in a way that allows them to have good self-regulation, which is what's
Yes.
needed for managing their
Yes.
feelings, their behaviors. That's how we want to raise children, right? To put
Yes.
our kids out in the world as grown adults who are self-regulating beings
Yes.
and who
Yes.
do not depend on external rewards
Yes.
and punishments and those kinds of things in order to manage themselves.
It's a poor regulatory system that leads to problem behaviors. If you want to diminish problem behaviors, increase the regulatory response system, which means you have to increase the oxytocin response system. And if you want to increase the oxytocin response system, you just can't stress your kids out anymore.
Yeah.
You just have to stop increasing stress.
Yeah. Oh, so good. You and I could talk for days about this stuff. I'm looking at the time and realizing we need to wrap up. I want to make sure that you have an opportunity to let people know where they can find out more about you, the work you're doing, your books, all that good stuff.
So we have a special offer that we're doing right now. It's at feartolovebook.com, feartolovebook.com. And parents, if they pay the shipping and handling, they will get a physical copy of my Fear to Love book. Now, for parents that are raising challenging biological children, this book is primarily for adopted and foster children. All you got to do is mark through the adopted and write biological. It's across the board. Everything I do speaks to human behavior. It's not about adopted. It's not about foster care. That's just happens to be my specialty. But if you go to feartolovebook.com, you pay the shipping handling, you get the actual book, we'll mail it to you. You also get an audio of the book, and then you also get a 1-hour webinar that I did. And that's probably just the single best mechanism we have right now for really helping parents. I had a dad, he's a truck driver raising his grandsons. He's like, man, I listened to half the audio book before my headphones went dead. And he said, I'm just, I'm those old school things. He said, thank you so much for sharing it with me. And then my regular website is postinstitute.com. So that's where all my information's at.
Fantastic. And so you have so many wonderful resources on that website too. Your books are wonderful. And I know you do a pretty regularly occurring Facebook live
Yes.
series too, because
Yeah.
I've caught you many times just scrolling on Facebook. So is that on your Post Institute
Yeah,
Facebook?
that's on the Post Institute Facebook page. It's usually 5 days a week, 6:30 p.m. Central Standard Time. It's called Post Daily Dose. And I come on, I call it the greatest little 10-minute parenting show on the universe, but really I go over 10 minutes most of the time.
It's great stuff. And we'll make sure that we have all those links with the show notes so that it makes it easy for all of you listeners to access those amazing resources. Bryan, it's been such a pleasure to have you on the show today. Can't thank you enough for spending the time with us.
Bless you. Thank you so much. Keep doing such great work.
Thank you. And thanks to all of you for listening to this episode. We'll see you next time on the Better Behavior Show.